Setting, ward. You're talking to a 35-year-old man who is refusing to go home after his treatment. He is medically stable at the moment. Try to convince the patient to go home. 1. Begin with warm greetings. 2. Ask why he is denying to go home. 3. Inform the patient that there is no need of medical support for him, recovering well, medicines prescribed, review once a month. 4. When the PT denies, politely tell him that unnecessary prolonged stay cannot be encouraged, rush in the hospital, new patients waiting. 5. Ask whether he has any other reasons for denial, offer assistance, social worker for support.
Good morning, Mr. John. My name is Sarah, the staff nurse on duty. How are you feeling today?
I am doing really good.
So I am here as advised by the doctor to inform you that you are doing really well and responding well to the medications, and we can see a good improvement in your health as well. So you are ready to go home. So may I proceed with the discharge?
I am feeling quite good and comfortable here. I'm enjoying my stay over here. So why do you want to discharge me?
I'm really glad to hear that you are feeling very comfortable with our care and service. However, there is no requirement of medical assistance for you anymore because you are doing perfectly well by yourself. So I hope you understand that.
Let me stay over here and I think I'll be perfect here.
As I mentioned earlier, we can see that you're responding really well to the medication. And the doctor has prescribed a set of medication which you can continue at home. And there is no requirement for you to stay in the hospital to continue with the treatment. You can go home. Also, you can continue treatment at home.
I don't think that's a good suggestion. I think the best thing, what you can do for me is let me stay here.
I can perfectly understand how you're feeling right now. But as I mentioned earlier, you are doing quite good by yourself and you do not have to stay in the hospital to continue with the treatment. You can go home and continue the course of medication. And once in a month, you can come back to the hospital. We can monitor your well-being. I hope you perfectly understand the situation.
No. I don't understand.
I do perfectly understand your situation, Mr. John. But, based on the doctor's advice, you are perfectly good to go home. I understand you find it pretty difficult to go home. But please try to understand that we cannot let a patient stay for a prolonged period in the hospital without any medical emergencies. In your case, you're doing perfectly good and there is no requirement for you to continue stay here. And also, this is a very busy hospital, and we do have a couple of new admissions waiting. Hope you get the situation. I know this might be overwhelming for you, but let me just check with you. Is there any other reason stopping you from going home?
I'll be so lonely at home. Once I get depressed and sad, and that's going to make me sick. And I don't want that to happen. I don't think you would also want that to happen.
I feel sad that there is no one to look at you at home. So, if I arrange a social worker, who can take care of you throughout the day, would that be okay?
I don't think. Let me stay here.
You know, Mr. John, the social worker who will help you in all your basic requirements. He can give you good food and also, he can assist you doing exercises, and come with you for your review. You do not feel alone. So there is nothing that you need to worry about that.
The loads of people over here. That's just one person. Please do not discharge me, please. Let me continue.
But please try to understand the situation. Letting you stay in this hospital is something beyond my scope of practice. As I mentioned, the social worker will help you in all your requirements that you need, not worry about it. I hope I have clarified.
Okay. I understood.
So I'll see you for the review next month, and in case of any emergencies, please free to contact us. Will that be okay?
Yeah.
Thank you for your cooperation, Mr. John. Do you have any other concerns?
No.
Thank you, Mr. John, for your time.